Lawmakers on Capitol Hill advanced Robert F. Kennedy Jr. to be Secretary of Health and Human Services. At his first confirmation hearing, he was pressed by both sides of the aisle about his views on abortion.
I agree with President Trump that every abortion is a tragedy. I agree with him that we cannot be a moral nation if we have 1.2 million abortions a year. I agree with him that the states should control abortion. President Trump has told me that he wants to end late-term abortions, and he wants to protect conscious exemptions, and that he wants to end federal funding for abortions here or abroad. That's Title X. I serve at the pleasure of the president. I'm going to implement his policies.
RFK Jr. also faced questions related to Title X, conscience objections, and state pro-life laws.
A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know.
Dr. Ingrid Skop of the Charlotte Lozier Institute says that during the hearing, there were many lies from lawmakers. She's written an article for our sister news publication, the National Catholic Register, diving into the dangerous pro-abortion line of questioning made during the hearing. And Dr. Skop joins us now. Dr. Ingrid Skop, thank you for joining me. Can you share your thoughts on what Senator Catherine Cortez Masto of Nevada implied about pro-life laws?
Yes, thank you for the opportunity to tell the truth. This is intentional, deceptive fear-mongering. And the intent is to turn the American public against pro-life laws. Every single state's pro-life laws allows a doctor to use his medical judgment to determine what to do in a pregnancy emergency, even if it's an abortion. No state requires it to be an immediate risk, and no state requires everyone to agree. But if that doctor believes it needs to be done, he is empowered by the state to do it. And of course, it's common sense that a law that protects unborn life is not going to prohibit a doctor from giving care to a woman when that life has tragically ended in a miscarriage.
RFK Jr. said that he and President Trump want to end late-term abortions, which many lawmakers have denied even exist. What is the reality?
The CDC tells us there are about 10,000 abortions in the second half of pregnancy every year. Likely there's more because some states like California and Maryland refuse to give any data to the CDC. These are children that can live if delivered and given appropriate medical care. These are children who can feel pain when they are dismembered in these abortions. And if the doctor does not kill the child first and does an induction abortion, very likely these are children who are born alive and left to die by infanticide. Most people think these are probably children with very challenging fetal diagnoses or mothers whose life is at risk. But research from the abortion industry tells us the reasons are the same as early abortions, primarily social and financial. And women I've spoken to in Texas tell me also coercion. 9 months is a long time for a woman to say no to a man who wants her to abort her child that she wants to continue to carry.
That's such an important point about just people being worn down. Now, Democrat Senator Maggie Hassan of New Hampshire brought up the abortion pill mifepristone. Let's take a listen.
You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved.
Dr. Skop, is mifepristone safe?
No, of course, it's never safe for the child. And in many cases, it harms the mother. Those studies that she's showing undoubtedly are from the abortion industry. They tell us the abortions they've sold and the complications they know about. But in many cases, between 15 and 50% of the women are lost to follow-up. They don't know the complications. And I should point out the FDA does not require mandatory reporting of a complication data. Since 2016, they've told doctors they only want to know about it if it kills a woman. When we look at better studies, we see that about 3 to 5% of women who take these drugs will require surgery for a complication. There are 4 times as many complications from these abortion drugs compared to surgical abortions. And I'm in Texas. I'm caring for women still that are being harmed because the FDA removed the in-person supervision, which allows abortionists like that New York abortionist to mail them in the mail to women in pro-life states. And there's no one to care for that woman when she has a totally medically unsupervised abortion and has a complication. She comes to my ER. I'm privileged to care for her, but I'm tired of them hurting the women in Texas and other pro-life states with this very laissez-faire approach to supervising these drugs.
And Dr. Skop, is there anything else you think our viewers should know?
Well, I think it's important to recognize that almost all abortions in our country are performed for social and financial reasons. These are women in crisis, often abandoned by the man who made them pregnant. We can help women in so many better ways by supporting pregnancy centers, maternity homes, coming alongside them, giving them the support they need, because surveys tell us that 60% of women with a history of abortion said they would have preferred to give birth if they'd only had more support.
Dr. Skop, thank you for the work that you do, and thank you for being with us today.
It's a privilege. Thank you for having me.